What's going on, guys? My name's Kai. I am an EMT in New York. Today we're gonna be reacting. What's up, guys? My name's Kai. Oh, what the heck am I doing? Jesus Christ. Yeah, this is my first YouTube video like this, so you guys gotta bear with me, okay?
Cancel the discharge, order a chest x-ray. Gotta rule out aspiration.
Incoming.
42-year-old male, Sam Wallace, blunt head with agonal respirations. Dropped down on the T-tracks. Couldn't tube him, LMA in place.
Okay, so LMA is laryngeal mask airway. In my region, we call it IGEL or super black airway. Basically, it's this tube with a pocket at the end of it. In a pocket or mask, it covers the opening to your larynx, and we're able to use a bag to ventilate you.
Suicide attempt? Rescue. He's a good Samaritan.
And also, when they say tubing, they're meaning an intratracheal tube that goes directly inside your trachea. Basically, it's supposed to be the golden standard of airway, but there's some discourse in whether IGEL or a ET tube, is better for patient outcomes.
Took a spill helping the woman who fell off the track. She's right behind us.
Okay, trauma one, go ahead. Come
on. Woman fall from T platforms, good vitals, no head injuries. Degloving injury, right lower leg with...
Oh, degloving injury. Never seen it in person. So basically, think of the skin as a banana, and you peeling that banana. Peeling that skin off.
Of the ankle.
Oh, okay, trauma two, let's go.
Oh my god, yo, they actually showed it. Like that, I don't know if that's even realistic because I've never even seen one myself, but that looks pretty realistic. Props to the makeup artist. Jesus.
How we doing? Ready? Okay, here we go. Ready? 1, 2, 3.
Good breath sounds bilaterally, but we need to protect his...
Apparently, he jumped down to save the lady when he climbed back up.
When EMS gave a report when they first came in, it's not typical. Again, in my region, it might be in your region. Wait for everyone to be in the trauma room. So that means the pharmacists, the RN, radiology, ED techs, LPNs, nurses, everybody's in the room. Then we get a report. And then after report, we usually head off to registration so they can get the patient's demographic.
Up, he slipped, fell back and hit his head.
Thanks.
It's more of an R2 Mel, right? I need you on the E fast. Pupils, 4 millimeters, and reactive.
So I also saw that this patient still has most of his pants on. And we have like a patient that experienced trauma, and especially if they're unresponsive, we usually try to get most of the clothing removed. We try to protect their privacy by trying to leave some of the pants on. Do you hear them? How dare they ruin my video? Go get them.
All right.
She's gonna miss the morning arrival of the living dead.
How many are we expecting?
We're getting 3, but 1 died en route. I don't know who's luckier, us or them.
What's open?
14.
89-year-old woman from a SNF. History of emphysema.
A SNF, skilled nursing facility. Basically, it's a nursing home with all the works. Rehab, nurses, CNA, speech pathologists, all the works.
History of emphysema, CHF, MS, VFib, unresponsive to 3 shocks, 2 rounds of epi.
What is that?
Lucas chest compression system.
The Lucas. This is actually pretty expensive. I think it's above $10,000 for one. It is just replacing CPR from a human by doing it robotically. There's like a little bit of discourse on whether it's efficient for patient care or natural human hands better.
System.
Robotic CPR. We're gonna get a hold. 1, 2, 3.
Students are dropping like flies.
Take a break, ice the finger.
You can count on getting a couple elderly patients every day around 7:30 after the nursing homes and assisted living facilities.
So yeah, that's pretty true. In the mornings, that's when shift change usually happens. So the nurse overnight is handing off the patients to the nurse in the morning. Being an EMS, I've only been doing it for a year. Sometimes you can't really blame the nurses. After doing rounding, they can find residents or patients that have been on the floor for hours. They gotta find patients that stop breathing overnight. There is a shortage of nurses out here, and it's real. One nurse cannot take care of a 60-bed floor, and it is happening. And this is causing negative effects for the residents and the patients due to the lack of staffing.
Bed checks, you can practically set your watch.
Was there an advance directive?
No, full cope for the nursing home.
Seriously.
Lucas off.
Still VFib.
Lucas on. 1 more round of epi, 1 more shock, and then we call it.
Yeah.
Nick Bradley, 19, found unresponsive by parents. No meds, no allergies. On arrival, he was barely breathing with pinpoint pupils, bradycardic at 38.
Pupils responded to Narcan, but we tubed him when his respirations didn't pick up.
Any drugs or alcohol on the scene?
No.
Signs of trauma?
So that is a endotracheal tube, like I was talking to you about before. That tube goes down into your trachea, and they secure it with a holder around your neck region here, and they hold that tube in place. Usually, there's like two ways that tube is going down your throat. You're either unresponsive, no gag reflex at all, and not breathing. So we take over breathing for you, or we do something called an RSI, rapid sequence intubation, basically pushing a paralytic and sedation medication in combination, and then pushing that tube, not pushing it, but placing that tube in your throat. The throat goal. But yeah, we take over breathing for you. There's a lot of circumstances where a paramedic might have to do that. I'm unable to do that because I'm just an EMT, but they're able to do that if necessary.
Nothing.
Okay, open your eyes, Nick. On 3. 1, 2, 3.
Where was he found?
In bed by his mom.
Pupils are 6 millimeters, non-reactive.
Heart rate 64, BP is cycling.
No response to pain. GCS 3.
Turns always present first.
I spent a month at the pain
No,
clinic.
it's not
Coming.
okay.
I'm very comfortable.
It's definitely not okay.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
Here we go. 1, 2, 3. How we doing, Ben?
One. Back in my throat.
That's probably from the
I didn't see facial traumas a lot. I don't think I've ever seen a facial trauma. No.
nosebleed. Short, rapid rhino, please.
Tachy at 120, pulse ox borderline at 90.
Low by at 15 liters for now.
Neck contusion, larynx shifted to the right, no crepitance.
4 of morphine. I'm gonna stick something in your nose to stop the bleeding.
No hemotympanum.
Inflate the balloon. How about now, Ben?
Better.
What's up?
Good vitals. A&O. Let's have a look.
Oh my gosh. Do you see that? I've never seen that before. I'm guessing that's the maxilla he's pushing up on. I've never seen a fracture of it. Yeah, it's just shocking.
Oh, ouch.
Floating face.
A 4-3 fracture.
You don't see that every day. Okay, let's prep for an airway. Double setup just in case.
Got an unresponsive, unhoused man coming in. Might be a good teaching case, funky music. Let's go.
Caucasian male, approximately 60 to 70 years.
Okay, so the homeless population have dealt with a few share. I always take them serious in their complaints. It could be Jerry that just wants a sandwich, and it could be Tom, found unresponsive, not breathing. I always try to give my best foot for them because they're in a dire situation at times, and all it takes is someone to help you, and you can change your life.
Go.
Caucasian male, approximately 60 to 70 years old, found unresponsive. No signs of trauma, no ID. So
again, interesting with the report. They say this patient has no signs of trauma, but yeah, he's in like 4 layers of clothing. I'm unsure how they did their assessment, unless they did the assessment and threw back all the clothes on, which I doubt. This guy's unresponsive apparently. How did they get vitals on him? It's pretty hard to do an EKG through 4 layers of clothing and blood pressure over an arm full of 4 layers of clothing.
On 3. 1, 2, 3. Ooh. Did you take anything?
Smell the alcohol from here. This guy's wearing the spring, summer, and fall collection.
Jeez.
Okay, again, that's pretty funny. So again, not very realistic because if this were to be true, those rats would probably be the ambulance instead of the hospital because his clothes would have been already removed.
What the?
What's wrong? What's going on? Patient tested positive for rats.
No.
Drug-seeking woman kicked off a city bus for disrupting and disturbing passengers.
I called 911!
She's been screaming for narcotics nonstop. We found an empty Percocet bottle
What are you
5 days
doing?
ago.
Why can't you call it? He's been uncooperative and combative since we picked.
Okay. So, again, I don't think this is a very realistic scene. They say they saw a prescription for Percocet and it was empty. So I'm guessing this patient deals with either chronic pain or some type of illness that causes pain. And the way she's agitated right now, I'm guessing she is in severe pain. Again, there's like different levels of the ambulance. There's BLS, intermediate, and then there's ALS. ALS is capable of giving analgesic to ease a patient's pain, or narcotics, if you want to call them. Kind of fault them for not giving the analgesic to this patient, unless something clinically indicated or some contraindication, hypersensitivity, or they did vitals and something was clinically indicated that this patient should not receive an analgesic at this moment. I would fault them. Again, I'm just a basic provider, but I'd probably say this patient would need a narcotic.
Off her! Let her go!
Stop fighting! Calm the fuck down or I'm calling the cops.
My meds at home aren't working. Please, I have sickle cell.
Okay, stop. Everybody stop.
Stop!
Okay, so she is a sickle cell patient. Sickle cell patients, basically, they have abnormal red blood cells, the shape of them. So the abnormality causes the RBCs to get clumped up in the area, and then that causes occlusions. And with that occlusions, there's ischemia, which is just lack of oxygen. And that lack of oxygen is causing pain signals to go crazy. So then that patient starts to feel severe pain. And I've had patients tell me it feels like pins and needles in their skin.
What's your name?
It's Joyce. It's Joyce.
And the way they entered, the EMS providers said that this is just a drug-seeking woman. I'm not sure if that's supposed to represent some type of racial bias. It's not uncommon that in EMS, there's been research about racial bias and EMS providers being biased against one population of patients and assuming information.
Joyce, is this your sickle cell pain?
Yes.
10 milligrams of IV morphine.
You really want 10?
Yes, repeat it in 5 minutes if needed. And she needs a dilaudid drip. This is a vaso-occlusive crisis. I'm so sorry this happened. It's gonna be okay now. We're safe here. Come on. It's gonna be safe here. I promise. Just breathe, okay?
I am a savage, classy, bougie.
Isn't that Megan Thee Stallion? Is that her song? She's hilarious.
Moody, nasty. I am a savage.
I need help. I got stuff.
Can you guys help? What's your name?
Alice.
So this happens a lot. Patients would just walk in the ER with a gunshot or a stab wound, or they cut off their arm. They just walk in there, or they got dropped off by a friend like this, and the friend just leaves. Usually doesn't want too many questions being asked, so he just leaves in there.
Okay, Alex, let me take a look.
This fucking hurts.
Oh, I know. All right, we're gonna take good care of you guys.
So yeah, when you have a GSW patients, again, ABC, don't forget D, there is X as well. Looking for basically blood loss, as well as trying to see if that bullet went through and through. Basically what I mean is if the bullet went into your abdomen, you want to see if there's an exit in your back.
Got you up here, Alex.
I got you.
I have an abdominal GSW in the ambulance bay. Code trauma now.
GSW just got dumped by Homeboy ambulance.
Okay, you got this?
Yeah, go.
2 grams of Ansep, ortho's on their way.
Systolics only 80, 14 gauge, left AC.
We got 2 units of whole blood going on the rapid diffuser.
Call the OR, we'll be right up.
If you like this video, you can hit that sub. I'm not gonna do all that, but stick around. You see how awkward I am, like literally. I really don't know how to do these videos. It's my first video, but if you guys want another reaction to EMS scenes, I can do that. Subscribe.